Alright, continuing on, we are going to talk about coronary heart disease. So I believe this is going to be the last video in regards to my series on cardiovascular system and diseases and other things related to it. So coronary heart disease, this is in other words coronary artery disease. So from the word artery, you can already say that the this disease affects the arteries, and it makes sense because this is the main cause of atherosclerosis. So yeah, they're very related. For atherosclerosis, it was previously said in the previous video, that atherosclerosis primarily affects the arteries. So yeah, affect larger coronary arteries on heart surface. Blood supply is blocked due to fat buildup in the coronary arteries. So what are the symptoms? Fatigue, you get tired more often. That's because the distribution of blood is affected in a way that there is not enough blood distribution in body tissues, especially the muscle tissues, which are important in the movement of the body, in carrying out the movement of the body. So, heart attack, heart failure, chest pain, and it's hard to breathe. So, those are symptoms. Diagnosis, exercise stress test, electrocardiogram, and echocardiography. For treatment, we have angioplasty, just the same as atherosclerosis. We have something that's called percutaneous coronary intervention, or PCI. We have coronary artery bypass grafting, or CABG. And of course, healthy diet will always be the most cost-effective treatment. You don't have to spend that much to live a healthy lifestyle. This is a common misconception. Usually they say that fast food is cheaper, but you're spending more at the expense of your health. So it's more expensive to pay the hospital bills in a time when your body gives up in being normal from being normal as a result of chronic consumption of fast foods. So yeah. Next, we have physical exercise. Uh, no, you have to keep yourself from smoking, and you have to control your blood cholesterol and sugar levels. And specific ways could be diversified a lot more. Medications. So we have cholesterol drugs. This is intended to reduce the bad cholesterol in the body. Although, yeah, from the word bad, there's also good cholesterol, and that's what you need. Good cholesterol such as avocado, or I'm not sure. Good cholesterol. I think avocado is a good cholesterol, or at least a lipid. We have aspirin. Aspirin is intended to reduce blood clotting, and beta blockers are intended to reduce blood pressure and slow down the heart rate. Okay, so let's go to cardiac arrest and heart attack. So cardiac arrest, or CA, primarily means that the heart stops because of an electrical problem. So the heart's natural rhythm is overridden by electrical impulses. And symptoms include abnormal breathing and short breath, loss of consciousness, heart palpitations, nausea, lightheadedness, and chest pain. Diagnosis, genetic testing. It is recognized that cardiac arrest can be hereditary, so it's in the genetics. We have imaging tests, MRI, CT scan, echocardiogram, and chest x-ray. So a heart that's prone to having cardiac arrests, visually, there's a way to find out if a heart has a higher risk of getting cardiac arrest. So these scans are important. Treatment, CPR, cardiopulmonary resuscitation intends to re-establish heart and lung action. Medications for this, anti-arrhythmic drugs, they treat abnormal heart rhythm. Sorry about that. Okay, let's go to heart attack. Heart attack, on the other hand, is the lack of blood flow to the heart. This is because of a blockage in a coronary artery. So heart attack is closely related to coronary heart disease and atherosclerosis in the sense that an artery is affected. So there is some buildup of plaque in an artery, particularly the coronary artery, which causes an impeding of blood flow. So heart will slowly stop due to oxygen deficiency. This is why there is a tendency to lose consciousness when you have a heart attack. That's because the brain isn't able to receive enough oxygen in order for it to function. Yes, you do have you are sufficient in other needs such as glucose, ions, um, but yeah, you need oxygen in order to function. And that's the reason why breathing is an involuntary action. It happens every time. So you don't have to do anything. Normally, you breathe. You inhale and exhale. So yeah, unless you intentionally keep yourself from respirating. So yeah, symptoms for heart attack, we have heart palpitations, indigestion, dizziness and fatigue, and short breath. What are ways to diagnose heart attack? We have electrocardiogram and blood tests. Treatment, coronary angioplasty. So particularly this angioplasty is for the coronary heart. So let's search coronary angioplasty. Okay, so this is intended to open clogged blood vessels of the heart. So if angioplasty by itself is intended to remove the buildup of plaque in arteries around the body, this kind of angioplasty is exclusive for coronary arteries. So yeah, stenting, I'm not sure what that means, but that's part of the treatment for heart attack. And medication, aspirin, is gonna help. It's intended to reduce blood clotting, as said earlier. It's the same medication that's used to treat coronary heart disease. And yeah, it's easy to think that these are closely related just because the medication is the same. Although it's not, the scenario doesn't happen all the time. You have the same medicine, but it's not there's not a basis in saying that these certain diseases are closely related. So okay, sudden cardiac arrest is not heart attack. For a victim of cardiac arrest, he or she is unresponsive. I take back what I said a while ago regarding heart attack victims being unresponsive. They are responsive. They are breathing. Their heart is beating, and they don't need CPR or AED. I don't know what it is, but this is cardiopulmonary resuscitation. It's basically pushing the chest with the rhythm staying alive, like staying alive, something like that. But for cardiac arrest, the victim is unresponsive. He or she is not breathing normally. The heart will have stopped, and CPR will be an important procedure that can be done even without a hospital. So yeah, paramedics usually do that, or someone who is a medical professional who is nearby that victim at the time of cardiac arrest. So yeah, a heart attack occurs when there is a blockage of an artery blood vessel that supplies blood to the heart tissue. The heart usually keeps beating, but for cardiac arrest, the heart stops beating. Cardiac arrest is more severe by what you see here. The heart isn't beating, so naturally, it's more dangerous compared to heart attack. It can result in death within minutes if proper medical care is not provided. So, yeah, I'm not sure if this guy had this cardiovascular problem. It was his cause of death. O.J. Simpson. I just knew him when the news talked about his passing. But yeah, cardiac arrest is one heck of a disease. A heart attack is less immediate but can still be very dangerous if left untreated. So yeah, that's it. Next video, respiratory system.